Hello, I'm Dr. Sharif. I'm a naturopathic physician. I have a practice in Seattle, Washington. My specialty is homeopathy, so today I'm here to talk to you about homeopathy. According to the World Health Organization, homeopathy is the second most used healing method on the planet, which most people don't know about. And it has been used widely by all kinds of people, famous people, politicians, I would say clergy, men and women, famous artists, and scientists, a few Nobel laureates, 11 U.S. presidents, 7 popes. The list is long, so it's been used widely throughout the world. Fortunately, it's on the rise. From what I can see, the use of homeopathy is on the rise. At least in the U.S., I can see there's a movement towards homeopathy, a positive movement. Homeopathic remedies can be derived from just about anything that sits, walks, or flies on Earth. So they can be derived from minerals, herbs, plants, and even animal and human tissues. The remedies that come at different potencies. The over-the-counter potencies start at 6C, 12C, 30C, and then the higher potencies, which start, I would say, at 200C or above, all the M potencies, like 1M, 10M, 50M, and they're considered prescription potencies, which at least in the U.S., they're not available over-the-counter. So the 200C, 1M, and up, you can only get them from I would say, a prescribing physician or homeopath. These homeopathic remedies are designed to stimulate your own innate self-healing. So they're not really designed to palliate symptoms. They're designed to promote what it is that your body can already do on its own. It just might need some support. Imagine if you had a cut on your hands and if you just watch it heal over a few days' time. Whatever is involved in that healing process is what homeopathic remedies try to support and stimulate. So you don't palliate symptoms with homeopathy. It's not like you give a remedy to palliate a particular symptom. You give it to support the body to do what it is that should be capable of doing, but it may be stuck. It may not be able to quite finish the job, so you give the remedy to finish the process. So we're not talking palliation. Pharmaceutical drugs, as a rule, they're palliative in nature, and the word palliation means basically covering up the symptoms without really addressing the root cause. Even, sadly, most of what I would consider natural therapies are palliative in nature. So if you take something for a particular problem and you have to take it daily, and if you stop taking it and the symptom comes back, that means you've just been palliating. So homeopathic remedies, really, at least, they hold the promise of curing symptoms and diseases. So you shouldn't have to take a homeopathic remedy every day for the rest of your life. They really are supposed to provide that cure. And they often do provide cure, at least certainly in the younger population. With children, I love treating children because they might come in with 5, 6 different symptoms, and you give a remedy, and you could get rid of all the symptoms at once and never see them again. With adults, of course, it's more complicated because they have various layers of imbalance in their body on psychological as well as physical levels. So often they might have to need a few different remedies at different times. They might even need other natural therapies, including lifestyle, nutritional therapies, and herbs and whatnot. But with children, it's usually they don't need much of anything. They just need a homeopathic remedy, and a month later they come back, all their complaints might be gone. And they may hardly ever need homeopathy again. It's pretty profound when you treat children. So again, just to give you a recap, homeopathic remedies are not palliative. They truly do provide that deep core healing that we all want. There are 2 methods of prescribing homeopathic remedies. The first method is called acute prescribing, and the second method is called constitutional prescribing. With acute prescribing, a great example would be if you fall down and hurt yourself, let's say get a bruise, you go to a health food store, and the clerk might recommend arnica, homeopathic arnica, which the over-the-counter potencies are 12C, 30C typically. And you use the arnica, and it can greatly help with the bruise, typically. That method of prescribing, as impressive as it may be, is really not what a professional homeopath would want to utilize at all times. There's this other method of prescribing that's much deeper. The remedies can provide a fundamental shift in your health on all levels, and that method of prescribing is called constitutional prescribing. With constitutional prescribing, the practitioner finds a remedy that matches the patient's I would say behavioral patterns, emotional traits, and all the symptoms, physical symptoms, head to toes. The practitioner might ask you questions literally from that covers all the systems. Let's say the neurological systems, the digestive system, skin. We ask questions about the joints, you name it, everything. And then we look at all the symptoms, physical symptoms, the person's emotional patterns, behavioral patterns, emotional traits, and we find a remedy that matches you on every single level. That remedy is called your constitutional remedy. And if you take the correct constitutional remedy, which is difficult to find, you really need to find a highly skilled professional who can do that. The remedy can provide fundamental, deep shifts in your health towards the better. In order to find such a practitioner, either they have to be licensed as a professional homeopath or a physician of some kind, like say a medical doctor or naturopathic doctor who has a specialty in homeopathy. And with constitutional homeopathy, I typically prescribe the higher potencies, like say the 200C or 1M, even higher. One of the other differences between acute and constitutional prescribing is that with acute prescribing, you're taking these lower potencies that are available over the counter, say 12C or 30C. The effect usually doesn't last that long. It may be hours to days. But with the higher potencies, the 200C and 1M, etc., which is what we usually use for constitutional prescribing, the effect can last for weeks to months. Although you can use any potency for whether it's acute or constitutional prescribing, you can do that. You can use the lower potencies for constitutional. Let's say you can take 12C or 30C of a remedy, particular remedy, as a constitutional remedy for the patient. But that's typically not the case, the way we do it. We usually, when we want to give a constitutional remedy to a patient, we usually pick the higher potencies that are by prescription only, and because they're more powerful, the changes are much more impressive. The results are much more profound in nature. And as far as how long they can last, again, the over-the-counter potencies, the lower potencies, they might last hours to days, tops. But the constitutional prescription-only potencies, 200C and 1M, they can sometimes last for months. But on average, I would say I give a remedy to my patients once a month when I'm treating them constitutionally, which is most of what I do. And what can you expect with homeopathic remedies? I would say you can break it up to immediate results versus long-term results. Immediately, there's changes. I would say there are general changes that the patient might experience. The general changes are usually involve your the energy and mood. So when it comes to energy and mood, I would say 90% of my patients, when they take the remedy in the office, before they leave the office, they report changes on those two levels. They say, my mood is surprising, I'm feeling better. Usually they say, it's maybe you, you're so upbeat that I'm starting to really feel happier. Of course, the incorrect remedy doesn't do that. So it's clearly not the practitioner that's doing the job, although that helps to be optimistic and positive. But the remedies do definitely matter, because even with the best of intentions, the incorrect remedy doesn't do a whole lot. So the correct remedy can provide the fundamental mood changes that most patients would like to see. And the energy, I would say 8 out of 10 times the energy goes up within less than half an hour. Now, there are cases, I would say, when the patient, when they take the remedy in the office, might feel actually more tired. That's temporary. That's usually when they've been going, and then the remedy puts the brakes on, brings up it balances the person on all levels. So if they've been, let's say if they have workaholic tendencies and have been pushing for days in a row, the remedy puts the brakes on, they might feel tired just for the day. But as a rule, though, the person's energy and mood, definitely, those two can improve. And then as far as other things they can expect, on a more of a long-term basis, they can have changes happening in all the systems in the body, including the mind, which is homeopathy, I would have to say, is the best kept secret when it comes to treating psychological problems. Next to therapy, I would say homeopathy is my most favorite therapy for treating psychological disorders of all types, including depression, anxiety, or even more advanced psychiatric problems, such as psychosis, multiple personality disorder, dissociation disorder. You name it. So homeopathy is phenomenal for treating psychological problems. But it also can address physical problems in all the other systems, like digestive problems, skin diseases, rheumatological problems, neurological disorders, etc. If you'd like to get a better sense of what patients experience with homeopathic remedies, you're welcome to refer to my website, drsharif.com. And there are different sections. You can refer to the appropriate section for patient testimonials. Just a word about what you should avoid if you're on homeopathic remedies. There are a lot of different elements that can antidote homeopathic remedies, can cancel the effect of homeopathic remedies. At the top of the list, unfortunately, is coffee. Any form of coffee, not caffeine, but coffee can antidote, I would say in majority of cases, can antidote the remedies. And there are some other things to look out for, like certain essential oils that have a very powerful smell, like menthol and camphor. Let's say when you do imaging studies, the contrast that they might inject you with, that can antidote sometimes. I'd say significant stress, physical or emotional, doesn't necessarily antidote the remedies, but it can wear the remedy down, so the remedy may not last as long. Same thing with pain. If a person has chronic pain, let's say they have severe low back pain every day, day in and day out, well, the remedy may not last a month, which is typically what I expect from constitutional remedies. They might need the remedy once every week or two. Or even daily doses of the remedy, maybe at a lesser potency. So I might give, let's say, whatever the remedy might be at a lesser potency of 12C on a daily basis, as opposed to their constitutional remedy at a higher potency of 1M once a month if they're chronically stressed or in pain. I would like to also have give you another word of caution, which is I would highly recommend against combination homeopathic remedies, which you may be able to find over the counter. Let's say they have concoctions that are pre-made, and they might claim that this particular concoction helps with stress or anxiety and whatnot. I can't say across, I don't want to make a blank statement. All these combinations are ineffective, but really they're not utilizing homeopathic principles. They're not necessarily finding that one remedy that matches you, that constitutional remedy that is a perfect fit for you. Although there's a possibility that remedy may be in the concoction, and it might help you to some extent, but it's really like a shot in the dark. So you really want to find a professional who is skilled in homeopathy to find that remedy that matches you on all the levels. And it's truly, in my experience, it's the most impressive branch of medicine I have ever come across. Of course, every system of medicine has great things to offer, but homeopathy is phenomenal. It's the changes that I see in my practice in a day in and day out, every single day. One could say it's either miraculous or it's just daily. It's like what we see in the office is a routine for me and my receptionist. We see profound changes every day. So for us, it's not really miraculous. But if you're not used to seeing homeopathic results, they appear like as if they're every single case, or a lot of them are almost miraculous. Having said that, patients need to make changes. They need to change their diet. They need to improve their lifestyle. It's not too uncommon that as a naturopath, I might prescribe other natural therapies to palliate. Sometimes I'm like, oh, you have significant, say, acid reflux. I might recommend DGL or digestive enzymes or bitters. But that oftentimes, as wonderful as those therapies are, they're not healing that deep underlying imbalance that's causing the problem to begin with. And that's where homeopathy comes in. It can balance that imbalance. And then even other natural therapies and even drugs can become much more effective in essence. So wish you the best. And you're welcome to email me if you have any questions. Thank you.